Welcome to the Community Health Heroes Show, where we spotlight local organizations that provide much-needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare, Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Mark Medina, Community Outreach and Education Coordinator with Metro Centers for Community Advocacy, who'll be talking about teen dating violence in recognition of Teen Dating Violence Awareness Month. And in recognition of Children's Dental Health Month, an encore presentation on keeping your child's smile beautiful and healthy. And joining us for today's Eat Fit NOLA cooking segment will be in the kitchen with Emily Eickhoff of Eat Fit NOLA, who will be preparing chocolate coconut truffles and giving us the latest scoop on the Eat Fit NOLA program. So don't go away. We'll be right back with more Community Health Heroes.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please
Don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Welcome to the Community Health Heroes Show. Did you know that nearly 1.5 million high school students nationwide experience physical abuse from a dating partner in a single year? Joining us today to talk about teen dating violence and what you can do to keep your teenagers safe is Mark Medina, Community Outreach and Education Coordinator for Metro Centers for Community Advocacy. Welcome to the show, Mark.
Thanks, Dr. Walker. Appreciate you having me.
So you're here to talk about teen dating violence. Can you tell me what that even is?
Yeah, absolutely. Teen dating violence is closely related to what people know as domestic violence or intimate partner violence. But in this case, it's perpetrated by a teen against another teen who is supposed to be in a dating relationship. And this is any pattern of behavior that's meant to maintain power and control over one teen. And they do that in a variety of ways: physical abuse, mental abuse, emotional, verbal, sexual, and nowadays even digital abuse, which is using tech or media in order to abuse the other partner.
Like kind of shaming somebody on a social media site?
Absolutely, or even technically stalking them, using their messages, checking excessively in with them through text messages or through emails, getting passwords to different social media accounts in order to really closely monitor and even control their daily activities.
What are the signs and symptoms you had seen a teen that was being abused?
Well, if you're a parent or even an educator or a caregiver for a child, you see their daily behaviors, and what you're going to look for is you're going to look for changes in the behaviors, attitudes, and even the type of things that they're doing daily. This can come out in problems with school, like maybe their grades take a drop off, depression, starting with some kind of substance abuse, drinking or drugs. Also changing their social patterns. Maybe they're not hanging out with the friends that they usually enjoy doing or participating in some of the extracurricular activities that they used to.
So both parents and teachers need to be aware that this is even out there and happening to our kids.
Absolutely. Parents and teachers are seeing these kids more than almost anybody else short of their own peers. And so it's really important for parents and educators and to really be looking for any type of signs that something serious is going on in their lives.
And what can a parent do if they suspect teen violence?
There are several things that are suggested for parents to do with teens that they suggest are in a dating violence. The first thing is not to overreact. And that's tough as a parent. You want to jump in and save your child. But we actually have some Some steps that are suggested. These things here, you can find them on loveisrespect.org, which is a great resource for teens and for adults to look at teen dating violence specifically. Some of the things, if you suspect teen dating violence in your child's life, are first off, and this is really simple but beautiful, is to listen and give support. That means not to jump in and start with the, why are you doing this?
Right.
Why are you shouldn't be doing this or that.
Not be judgmental, but be
Absolutely.
more open and receptive.
Absolutely, because remember, these are those relationships, those formative relationships in the early years that mean so much to these young people. And so don't step all over that, with the when I was your age, but find out what's going on, because you were never the age that they are right now today, right?
We didn't have Facebook.
Absolutely. And so starting off with things like, you don't deserve to be abused, rather than here's what you did to deserve this abuse, right? Also, accept what your child is telling you. And that's, sometimes some of the things they come to you may sound sensational or, like, that never would have happened to me when I was a kid. Well, things are a little bit different now. So take it at face value and go from there. That's really going to be appreciated by your child. Also, show concern. Right? You don't deserve this. You deserve to be in a relationship where you're respected and treated well and equally. This isn't your fault. Focus on the behaviors, not the person. This means substituting statements like, that person's controlling you, he or she is controlling you, with, it really concerns me when they're constantly texting you to find out where you are.
Wow.
Because that indicates a controlling behavior, right? And so it takes the onus away from that teen that you're trying to talk to maybe jump to the defense of the person that they're in that dating relationship with. Because remember, this is someone they're supposed to be in a caring relationship with that's abusing that. Also, avoiding ultimatums. You don't want to say, you are going to stop. Yeah, absolutely. Stop doing this or you're grounded for a month. Because as soon as you do that, you may just drive them deeper into that relationship. Right? And be prepared. Educate yourself. And that's what we're doing right now. What is dating violence? What should you be looking for? And what are the resources out there? And then finally, and most importantly, decide on what the next steps are together. This should be something you collaborate with your teen over. They have agency, and you should encourage that, because they're only going to get out of that relationship when they're good and ready to do that. And so help them make the best decisions, but it has to be their decision.
Absolutely. Now, I understand the statistics in Louisiana are emerging and they're changing, and this is something kind of new. So can you tell me a little bit about the statistics with teen dating violence?
Absolutely, Dr. Walker. And the statistics, part of what's concerning is that they are so new and that we have so few statistics. Now, there's an organization called Next Steps Louisiana, and in collaboration with Louisiana Appleseed, who has a great mission. One of their missions is to help end teen dating violence in Louisiana. They started doing a survey. They did this in 16 schools throughout Avoyelles, Grant, LaSalle, and Rapides parishes. And what they found when they did this study with the students was that first, it's an important problem. 93% of the students that they surveyed said that teen dating violence was an important issue and a serious problem. 14% were in abusive relationships. 6% weren't even
they admitted
sure.
it, so,
Absolutely.
wow.
6% didn't know if they were or not. 40% who said that they were in abusive relationships said that they had been hit, pushed, or shoved. A third said they had been threatened with violence. 16% said they'd been choked by a partner. And remember, these are teens, not adults. Almost 20% unwanted kissing and touching. 8% forced sex. These are our teens, our adolescents here. More than half yelling and screaming as a part of their normal relationship. Almost 40% excessive calling and texting. 20% stalking and spying. And almost 75% with the name calling. Once again, these are supposed to be those formative relationships that kind of pattern out what you're going to accept as normal and acceptable for the rest of your life. And this is not the way we want them starting.
No, absolutely not. So Mark, can you tell me about the resources that are available?
Yeah, absolutely, Dr. Walker. First, of course, I'm going to put in a plug for my own agency. I work for Metropolitan Centers for Community Advocacy. We were recently rebranded that. Up until this last year, we were Metropolitan Center for Women and Children. Okay. And we're a domestic violence, sexual assault, and stalking agency. We help anybody who is dealing with those serious issues, and that includes children from as young as 4 years old, unfortunately, up through adults that may even be experiencing the effects from past traumas. Okay. And so that includes, of course, any teens who would come to us and are experiencing dating violence. Also, Family Justice Center, that serves Orleans Parish. So if you're in Orleans Parish, they are our sister organization serving there in Orleans. Then also, I already cited Louisiana Appleseed. They're a great organization. They have several different missions, but one of them is a program they have which is abuse prevention through education, and that's specifically targeting teen dating violence. Wow. So I encourage anybody who's serious about finding out about this issue to look up Louisiana Appleseed. Just Google it, you'll find it. And also a great resource for both teens and parents that is completely dedicated to teen dating violence is loveisrespect.org. This is a national and online organization that gives out great resources, statistics, all sorts of great publications that directly address and help combat teen dating violence. And that includes a chat line for teens that they can call into, peer hotline so that they can get peer advocacy help if they don't want to talk to an adult. Because as much as parents might not like this, they may not be the person that their teen wants to talk to about this. And of course, they can always email in, and that's wonderful. So those are some great resources for both adults and for teens.
And this wasn't a prepared question, but are we also educating the teachers on what they can do in the classroom? I mean, could they go to Love is Respect and maybe share something, or are the schools giving seminars on this, or what's going on in our community?
Yeah, absolutely. I'm glad that you asked that. Actually, there's legislature that covers this. Okay. Right now, Louisiana law mandates teaching teen dating violence prevention in schools. And so actually, awesome. All Louisiana public schools are required to teach 7th through 12th grade students and school employees about the dynamics of dating violence. And that was a combination of laws that were passed in 2010 and then updated in 2014. And so those are really important. It's important to know about those. So I encourage you, if you go out to Louisiana Appleseed, once again, you can find that legislature. And if it's not being done in your schools,
something that our audience can ask their kids, Absolutely. Are you learning about this in school?
Yeah, and you know what?
And that could open the conversation.
Ask the administrators, ask the superintendent, is this being done in our kids' schools? Because the law says that it's supposed to.
Absolutely.
Because I'm going to tell you, it's as startling as our state statistics are, our national statistics reflect that same type of urgency in dealing with this matter. I'll say this.
It's not just Louisiana.
No, it's definitely not just a Louisiana problem. This is a problem that is plaguing our nation. Here's some of the statistics that actually go nationwide. Nearly 1.5 million high school students are experiencing physical abuse. That's just the physical abuse from a dating partner in a single year. Also, 1 in 3 adolescents in the U.S. are a victim of physical, sexual, emotional, or verbal abuse from a dating partner. And that far exceeds the similar figures for other types of teen violence.
I'm so glad you came on the show today, because I think our audience will probably be just as amazed with these statistics as I am. One more time, if we want to go to the resources, what is the best source of resources for this subject?
The two that I'm going to recommend are loveisrespect.org. Okay, all one word, loveisrespect.org. Okay. And then you can always come to Metropolitan Centers for Community Advocacy. You can find our website at www.mcwcgno.org, or just Google Metropolitan Centers. Okay. And then they can always call us at 504-837-5400. If you're not sure, give us a call. We'll help you work through the issues.
Awesome. Thank you so much for being on the show today and providing this valuable information.
Absolutely, Dr. Walker. Thank you.
And we'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke. I'm Paul George. Learn the signs of a stroke fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome to Community Health Heroes. February is National Children's Dental Health Month. In recognition, we're going to offer an encore presentation on dental health that will help you help your children keep a beautiful and healthy smile. Welcome to Community Health Heroes. February is National Children's Dental Health Month. Did you know that, just like fingerprints, tooth prints are unique to each individual? Joining us today to discuss your children's dental health is Dr. J. Dumas, General Dentist and Dental Director at the Dental Clinics of Daughters of Charities Health Centers. Welcome to the show, Dr. Dumas.
Thank you.
So you're working in a pediatric dental office?
Yes, I'm the Dental Director for Daughters of Charity Health Services, New Orleans.
And so when should mom or dad first bring their child for their first dental visit?
The American Academy of Pediatric Dentists recommend a 1-by-1. That's the first visit by the first year.
Okay. Whether they have teeth or not coming up?
You know, I tell parents if you see teeth coming in, that's a good time to bring them to the dentist.
Okay, that's a really good advice. And how do you make that first visit comfortable for the parents and the child?
You know, that first visit is really important. You want the child to feel comfortable, with you, invading their personal space. And you want the parent to also feel comfortable, for you to be their child's dentist.
And what do you do to do that? How do you make it comfortable for the parents and the child?
Well, we try to make it as easy as a first visit as possible. Normally, a first visit doesn't include x-rays. We just like to educate the parent and spend some time with the child, getting them used to people invading their personal space.
And do you educate the parents, like maybe how to do oral hygiene, maybe brush the couple teeth the child has?
Correct. We go over a good number of points that we like to point out to our parents, as far as baby bottle decay, things to look out for with the bottle and nursing, and just the beginning of childcare for their children's teeth.
Okay, that's great. And candy, we always hear, is not really good for the teeth. What do you tell parents about eating candy, too much candy?
Everything in moderation, yes. Too much candy can cause decay rapidly. Any kind of foods with carbohydrates in it can convert to sugars, which can cause cavities.
And then a lot of kids are in sports nowadays. What do you recommend to protect their teeth while they're in sports?
2 things, helmets and mouth guards.
Oh, helmets too.
Yes, for high-impact sports, particularly football, we recommend helmet and the mouth guard, and biking. But for basketball, definitely a mouth guard.
Then what kind of sports would you recommend the mouth guard for? You said biking, football?
Biking,
basketball?
football, anything that's high-impact contact, where they're going to be taking a physical exertion. Yes.
And then get those right over the counter nowadays?
You can get them over the counter. You can get the ones from the local sports stores where you boil them and have the kids bite down into them, or you can have your dentist make one.
Okay, that's really interesting. And you were saying earlier that there's certain sports that are more dangerous, but yet most people don't think they're dangerous. Can you tell me a little bit about that?
Believe it or not, most people would think football, but basketball, we see more elbows to the face, injuries to the teeth.
And then also bike riding.
Bike riding, yes. We recommend wearing a helmet as well as a mouth guard.
Because they could fall and chip their teeth on the handlebars or just
Correct.
fall and break
Correct.
their teeth. So that's a lot of sports that you really have to protect your teeth with.
Yes.
So Dr. Dumas, if our audience wanted to find out more about dental clinics, where they're located, how could we find that information?
Daughters of Charity, we have 9 locations in the city of New Orleans. 3 of those locations provide dental care. One of them is at Carrollton Avenue, the other one's in the Bywater, and the other one's on Dillard University's campus.
And you just would call for an appointment?
Yes, they would just call for an appointment. We have a phone number, 504-212-9550.
All right. Well, I really appreciate you taking time out of your busy schedule to be here today.
Thank you for having me.
When we return, we'll be in the kitchen with Emily Eickhoff, who will be making chocolate coconut truffles for today's Eat Fit NOLA cooking segment. So be sure to stick around for more Community Health Heroes.
I'm Molly Kimball, registered dietitian with Oxnard's Elmwood Fitness Center. We've collaborated with more than 60 local restaurants to create Eat Fit NOLA, a partnership that highlights the better-for-you items right there on a restaurant's menu, making it effortless for you to dine at your favorite New Orleans restaurant without ditching your otherwise healthy diet. Every month, the Community Health Heroes Show will shine a spotlight on one of our city's incredible chefs who will show you how you can make healthier choices when dining at theirs or any of our city's great restaurants. So don't go away, Community Health Heroes will be right back.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back. Joining us today in the kitchen is Emily Eickhoff of Eat Fit NOLA, who will be preparing chocolate coconut truffles and giving us an update on the successful Eat Fit NOLA program. Welcome to the show, Emily.
Thank you so much for having me, Dr. Walker.
So what are you preparing today besides this yummy, delicious dish here?
Yeah. So it's some really simple ingredients. It's great for those late night cravings. We call it the witching hour, between 8 and 11 p.m. where you're craving chocolate and nothing will satisfy it unless a piece of chocolate, you know? So these are all ingredients you probably have in your pantry right now, to be honest. So
wow.
Very simple, very easy, and very quick.
And how many calories are in each one of these?
Yes, so one ball has about 130 calories. But it's not empty calories. You know, we're using heart-healthy fats. It also has a bit of fiber as well, which you don't find in many chocolate bars or anything like that. So you do get a little bit of fiber with it as well.
And usually we think of desserts as fattening, but that's not true with Eat Fit NOLA.
Not necessarily. So there are good fats, there are bad fats. So we try to aim to have more plant-based fats in our products. So, you know, coconut oil, avocado oil, things like that are going to be a little bit better for you than your butter, your heavy cream. Right. So we are using coconut oil in our recipe today to cut out some of those bad fats.
Tell me about Eat Fit NOLA. It's had some pretty exciting updates.
Yeah, we do. So we have about 150 partners now between North Shore, New Orleans, and Baton Rouge. We have just expanded so much. We're actually going to Michigan in the next few months, so it's been really exciting.
It is. That's very exciting. So do you want to go ahead and prepare this? It doesn't look complicated, you said.
It is not complicated at all. Just a couple of simple steps. We have 2 cups of shredded coconut flakes. I've divided them in half, and I'm setting one aside.
Okay.
And so the first thing I'm going to do is I'm going to take coconut oil.
Oh, we're going to use a food processor.
Yes.
Okay.
So I melted the coconut oil. You can do this in your microwave, put it outside for a minute. Coconut oil melts pretty quickly.
Because it's 70 degrees outside.
Yes. And then, so I'm going to take my honey. This is a quarter cup of honey as our sweetener. And this is great because each ball actually has less than a teaspoon of added sugar.
Oh, wow.
So,
and this recipe makes all those little balls there?
Yes.
Wow, that's a lot.
You're right. And then I'm going to just take a teaspoon of vanilla. And
you were saying before the show that this is gluten-free and also vegan?
So, nothing. There's no dairy or, you know, wheat or anything like that. And I'm just going to do a dash of salt to kind of balance out that bitterness. Then I'm going to...
so you don't put the cocoa in yet?
Don't put the coconut flakes in just yet. We're going to blend this up first and then add the coconut. Okay. So just let that blend for a few seconds. You want to make sure the top is on so that it doesn't all fly out.
And if you didn't have a food processor, could you like use a blender or one of those immersion blenders?
Yes, I feel like you could use pretty much anything. It's really just combining the ingredients in a food processor makes that pretty easy. So I'm going to take my cup of coconut flakes that I set aside earlier and just add those in.
Now those are unsweetened coconut flakes?
These are unsweetened.
So be careful to buy the unsweetened coconut flakes.
Yes, you don't want that added sugar in there. So I'm going to mix this.
Okay.
Until it looks nice and combined. Next thing I'm going to do, I'm going to take my cocoa powder right here. I'm going to actually sift it to get it to that fine consistency. We don't want any chunks of cocoa powder, you know, take a bite out of it. So.
And that's just pure cocoa powder?
Just pure cocoa powder, yeah. So just
a lot of cocoa powder.
Yes, so 2 cups. We're just going to sift real quick. So those giant lumps, I'm not going to worry about this as much. So we have our 2 cups of cocoa now sifted. The next step is actually getting the cocoa into the food processor. So you don't want to dump it all in at once. We're going to do about half of our, maybe like a cup sifted at a time. So we're not going to do it all at once.
That is a lot of cocoa, but you made a lot of little truffle balls.
It does make a lot, yes.
Yeah.
So.
And I guess you could half the recipe if you didn't think you would. If it's just you.
Yeah. If you it makes 15 to 18, and so it's good to split it up. So I'm just gonna mix that. All right, and that's combined. We're gonna add the rest now. You can see it's kind of getting a little bit thicker, and it'll give us that, really dense consistency that we want in a truffle.
And is this dark chocolate, or I know it's pure cocoa, but I mean, do you?
So, yeah, so I feel like dark chocolate has less sugar, it has more antioxidants, more vitamins than, white chocolate does or milk chocolate. So it's good to pick the unsweetened cocoa or
so just pure cocoa.
Pure cocoa, or even, if you are buying a chocolate bar, it is good to go for the 70% or 80% cocoa, things like that.
You can see the cocoa powder.
Yeah, you don't want to breathe in. So,
it smells really delicious.
Yeah. So now that's kind of the consistency we want. We want it to be very thick and pretty dense as well. So are you ready for the final step? I'm gonna actually get this back in here. We're gonna,
oh, it is really thick.
Yes. Just take a spoon, grab a little bit.
It was really it thickened up nicely.
It thickened up very nicely.
I didn't think it was going to.
So it's not the cleanest recipe, as you can see, but you get your hands a little bit dirty. You want to shape it into a ball, so a nice round ball.
Okay.
And then just drop it into your coconut flakes, and then voila, you have your truffles, and that can go in the fridge and locked in an airtight container, and it comes out perfect.
Awesome. So it looked like a lot of these ingredients were from Whole Foods. Can you tell me about your partnership, Eat Fit NOLA, with Whole Foods?
Yes, so our partnership has really grown and evolved over the years. Initially, we were just doing one cooking demo each month at one location. Today, we have a cooking demo going on at all 5 locations here in Southern Louisiana. So from the North Shore to the 3 here in New Orleans, all the way to Baton Rouge, we have a cooking demo going on once a month at those locations.
So it's once a month. What day of the month is it?
So it's always different. Never the same really for each, so you can check our website to find out that those dates. We also offer a grocery store tour after the demo where we'll go to a specific aisle in the store, give the customers a sneak peek into the products and ingredients and things like that, so it's really nice. One of the most exciting parts is that they've actually given us all access to go into their stores and pick out our top 3 picks from each food category. We have our top 3 picks. They're going to be labeling it with our Eat Fit logo.
My gosh.
Yes, so it's very exciting. These are products that meet our criteria. They have good, wholesome ingredients.
So like it could be a soup. I mean, I'm just asking.
It could be soup.
Okay.
It'll be lower in sodium, lower in fats, things like that.
And it'll say like Eat Fit NOLA recommended, or what will it say on there?
It will be our little bright orange shelf tag, so it'll have our Eat Fit logo on there.
Oh my gosh.
Sure. Yeah.
So we want to know more information about either the Whole Food relationship or Eat Fit NOLA. Where would we go for that?
Yes, so you can go to our website, eatfitnola.com, or you can also, if you would like to sign up for a cooking demo, you can email eatfitnola@gmail.com.
Awesome.
And they'll be able to help you with that.
Well, thank you so much, Emily, for being on the show.
Thank you so much for having me.
Delicious.
So fun. Yes.
All right, and we'll be right back with more Community Health Heroes.
Hey, Hard, what's this?
That's my resignation letter.
You're resigning.
Why? Because you're constantly ignoring me. You're half as active as you used to be, and you get stuff like this. You've been putting me under a lot of pressure lately. That's why I'm ready to quit.
I forgot. I'll do better. Please,
Don't quit on me. Okay. But remember, it's not what you say, it's what you do.
Listen to your heart. Don't let it quit on you.
Let's go for a walk.
Uncontrolled high blood pressure could lead to a stroke, heart attack, or death. Get yours to a healthy range before it's too late.
Thank you so much for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com or visit our website at communityhealthheroes.org. You can also find our show on YouTube. We hope that the information we provided today has helped you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.